next speaker doesn't need an introduction. Dr. Professor Faissal Shaheen, who's Director of Saudi Center for Organ Transplantation. Faisal is a friend, a colleague over the past 20 years. We had a lot of good time, but also sometimes bad times, because he's at the supply end, I am at the consumption end, and my demands are always very high. But always he's been tolerant to our demands in the transplant programs in the kingdom. Dr. Shaheen is, as I said, is well known. He's actually a member of numerous international and national organizations, as well as he published several papers and chapters in books, more than 100 articles in well-recognized journals. Beside all of this academic and administrative activity, he's dedicated to his patients as a well-known consultant nephrologist and also director of the biggest kidney center in the kingdom. I don't want to spend more time on introducing him. He deserves much more than what I have said.
Thank you, Muhammad. I really appreciate your kind introduction. It's too much for me. And probably I'll start by Chairman, my sister, Dr. Mona, and my brother, Dr. Adnan. And I am a student of Dr. Ghunain, so please don't stop me when I finish. This is what he teach me. So I will take sometimes more time maybe. Today I'm going to speak about our organization in Scott and what we did and what's our result. And probably I will touch again our work in GCC country. This is the Saudi Arabia. Everyone know that we have a very wide area, 2.2 million kilometers, and our population, the recent one, is 27 million. We start by initiating the National Kidney Foundation in 1985, and in 1986 our program started by doing just few cases, and 1993 NKF upgraded to be Saudi Center for Organ Transplantation. This is our place, and we are supervising and coordinating all the transplant activities in the kingdom, in all the hospital, either military or National Guard or Ministry of Health or private sectors. We have our directory, which is considered to be the law of transplantation in the kingdom. Now it is under revision after many years because of the new development in transplantations in the world. So probably our new regulations will be implemented from the next years. We have database for our patients since we start in 1985 and about the renal patient, and now we have database for all the organ failure patients about the transplantations, brain death activities, and supplies, and also urgent waiting list, and all of this we had it in our database. The source of organ donation, this slide is for the kidney. We supposed to have one for the liver, which is a little bit difference between living deceased donors and non-heart beating donor. The major in kidney is 70% is now from living donor, and the moderate source is deceased heart beating donor. And deceased non-heart beating donors, only few cases done by Dr. Nizam al-Din and myself. This was long time and we didn't repeat again. Probably in the future we have to implement this and to have some dedicated people for non-heart beating donors. So, excuse me, can I wait for a second? So the total number of intensive care units which we have in the kingdom is 116, and the total ICU bed is 2,276, and emergency service is 324, and we have Red Crescent is 238 center and 681. Why I mention the intensive care? Because again, one of my thoughts, which I think is very important, that if we don't have enough intensive care, we will not have more brain deaths. And one of the targets which we should think about the future to have more donors is to have more intensive care bed, or to have dedicated intensive care like what we have in Spain for the brain death cases. This is the transplant centers. We had 17 for the kidney, cornea 10, heart 3, liver 4, and lung 2, and pancreas 2. And this is the renal transplant centers we think that it's very important to have in the area, because too many patients need a kidney transplant in different places. That's why we have in different areas in south, west, and east, and all the area we have a kidney transplant center there in order to make the transplant in the same city or nearby the patients. We are using the Medivac, which I think is very important for us, for transporting organs, for transporting teams to take sometimes to disease the donors from one area to another facility for diagnosis and also for retrieval. The tool of Scott is mainly for the medical community about training, curricula, conference, band visit to the hostel, and National Scientific Regulatory Committee in each hostel, and we do a lot of publications for the medical community about transplantation. We have a monthly training program for the people from different areas in Scott, and this is dedicated for the people in neurophysician, neurosurgeon, about the dialysis sometimes, about another activity which is related to the transplantation. And we have manual about the training manual which is being given to each one after finishing this course, which usually take two days. For the public, we make a survey in 86 and 89. We have school visit, especially in Riyadh area. We have a team to go to the school in order to show to them the importance of transplantation. We distribute donor card, and we take any advantage of any conference in order to send Scott people in order to promote for organ donation. Now the GCC committees we started the first one was in 1992. And this committee, out of this committee we have a lot. After having this committee, things improved between all the Gulf country, and we have almost every year or every other year a meeting in order to improve our result and our work together. And this is a picture from last meeting. You can see this was in Riyadh in February 2010. And this, I think, one of our important meetings that we have a lot of decision to improve the activities between our Gulf area. By this meeting, we had the first GCC celebrations of the World Kidney Days. This also done in March 2010, because this was, again, something come out from the committee that we should do that. Saudi Arabia taking over, and we did the first celebration. And also at the same time, we did the first GCC celebration of the World Day for organ donation. This was in October in 2010. And I'm sure that the next country probably will be Qatar and Bahrain. They are going to take over such activities in the future. Again, one of our activities in GCC is to have medical education, and you can see in this picture, you will see Mona is there. She's with us, and she's in the picture as well, and Ali and Frank Domenico and Dr. Awad also. And many other, Dr. Ziad, Dr. Bashir, many others colleagues working there. I was at that time not in this Congress. Dr. Mousawi also here. Now we speak about the trend of the brain death. And if we have any program and it is consistently going on, so we have continuous reporting, this means that program is working. Continuous transplant, this means that program is successful. And I think we have a successful program. And as we can see that this is the trend of the reporting of the brain deaths. We have median of around 600 cases every year. And this is the consent obtained, which again, it seems to be that we a little bit start to be improved, and probably we will have even more better in the future, because we start to have now almost around 115, 120 cases every year. And this is, again, if we look for our possible the brain death cases and eligible, which have been documented, and the consented cases, which is more than 1,444 cases, and actuals which have been utilized is 1,311, which shows that, again, this is the activities which been done long time and consistent, and as a result of this, we have so many patients being transplanted from the deceased donor and living donor. The total deceased donor from kidney is 2,227, and from living donor is 4,395. And as you can see, the number is increasing. This year, we expect that we will have almost around 700 or 750 kidney transplant. This is for the deceased liver transplant. We have total numbers of 571 cases now, and the total living is 358. Also, there is a booming now in living donors liver transplant at both centers, King Faissal Specialist Hospital and National Guard Hospital, and this year we'll have much more than the numbers which we had it before. About heart transplant, we have medium of 20 heart to be transplanted every year, and recently there is a new initiation again from military hospital in Riyadh. They want to start their program again, active program again, and I hope that in the future we'll have more. We start to use the heart for valve since 1993, and as you can see in green, there is a lot of heart being used for valve with co-work with the King Faisal Specialist Hospital. This is the deceased organ donations. As you can see, we had 2,227 kidney and liver 571, whole heart 187, and we used heart for valve 517, and pancreas 18, and lung is 45, and cornea retrieved locally 632. For the living kidney, 4,395, and for the liver, 358. And we had, again, the regulations for unrelated, non-commercial transplantations, and this is very rigid program, which again, we have few numbers for kidney and for livers coming from out of this program. The kidney graft survival and patient survival is quite comparable to anywhere in the world in the developing country. The patient survival in 3 years is in 3 and 4 years is 93.2 for the kidney, 0.2%, and 81.7% for graft survival. And for the liver, from diseased donor in the 3rd year is 83.1, and from living donor is 91.2%, which is very good numbers. And for the heart, in the 4th years, we have 76.4% outcome. Now, organ sharing program between Kingdom and other countries, we have almost 178 organs shared between us and different countries, including the GCC. And this one, so the GCC contributions, and as you can see, the highest number is between Saudi and Kuwait, and then Qatar, and recently Bahrain, and before we have a good cooperation between Spain, and we have 17 organs from there. And there is a derivative between kidney, liver, whole heart, and lungs. Again, if we compare our work in Scott in 5 years, compare 2000 to 2004 versus 2005 to 2009, we will see there is a significant increase in number of donations. significant increase in numbers of transplantation as well, and also in reporting. Hopefully we can continue like this and continue in a steady state in order to have more organs to save more patients. Again, this is the same comparison which shows the difference between 5 years and another 5 years to show that still our work is good, but it's not enough to combat with high patients. We have our annual report. It is very transparent report about all the organs, and everyone can reach it and can see it. And by the way, if you can notice that we are the reference center in GCC country. We've been recognized as the reference centers in Gulf country since maybe 5 years now, and we continue doing our job, and hopefully we'll continue to be the reference in the area here. Saudi Arabia became again one in the map in the world, and still, if we compare the deceased donors with living donors, we still need to work more in both sides in order to be in the middle and to be like with what we hope that will be like US, Sweden and UK, in order to have both sides, deceased donor and living donor together, and to be shifted to in the mid of the map of the world. I conclude, Mr. Chairman, that organ transplantation is very well established modalities of therapy for end-stage organ failure in the kingdom, and all types of transplantation should be encouraged to reach self-sufficiency. Saudi Arabia has a strong collaboration with Gulf countries in the field of organ transplantations and donation. Thank you very much.